thank you very much for coming along today. When we started talking about being here today, Colin, Mary-Jane and myself, we wondered how many people would turn up, and I understand we've had nearly 150 people here. And I know that there are many people in the audience today that will know much more about MECFS, sticks and stones names, than I will. But what I'd like to talk to you about today is the work that Action for ME is doing. Mary-Jane and I are going to do a bit of a double act. So I'm going to say a little bit about Action for ME. Mary-Jane is going to say a bit about the work they're doing in AIM. I'm going to come back and tell you a little bit about what the UK Research Collaborative is doing. And Mary-Jane is going to finish off by telling you about the patient-public researcher session that we had at the Research Collaborative Conference. So we'll be up and down a little bit. So what I've called my talk ME Time to Deliver because that's the name of the report that we produced earlier this year based on a large-scale survey that we did. And we're still analysing the findings of that. I'm going to give you a little bit of information about the sort of initial findings, but also to say a little bit about our work and, as Keith said, the research that we're funding. So I've been in the organisation just over 2 years, but our work's continued for the last 26, 27 years. And over the last couple of years, we've really built on what work had gone before. And we've developed something that we've called our 3 strategic touchstones, if I can say that. And that really is the kind of 3 strands of work that we do. So our Inform and Influence strand encompasses a whole range of work. We're funded, for example, in Scotland, we get a tiny amount of money from the Scottish Government, the only government funding that we get, to work with GPs. And on the back of a survey with 50 GPs, we've then gone on to develop a series of webinars and resources that are used to support the work. GPs themselves tell us, and not just us, but also in large national surveys, the challenges that they face with diagnosing MECFS. And it's very easy to bash GPs and consultants and clinics and the NHS. There are many that do a fantastic job, but there are also many that do not know enough about this illness. We work very closely with other charities as part of the All-Party Parliamentary Group. We're a member of Forward ME. We're involved with Disability Benefits Consortium. So we work hard to try and influence what's going on at a policy level. It's like banging, and I say this is being recorded, it's like banging your head against a brick wall sometimes. But we have to try, and that's why things like our surveys, the research that's being undertaken, talks that I know Gabriella's done with GPs in this area, that's why it's so critically important that we continue to produce an evidence base that helps to shape and influence people's minds, like Caroline who came along earlier on. She wouldn't have come today if people like Colin and David and others hadn't talked to her about the impact of this awful illness, if she hadn't spoken to people in her constituency that shared their experiences about this awful illness. Our second touchstone is what we call empower and support. And in the last year, we've provided information, advice and support to over 400,000 people affected by ME. That's not just people with ME, it's carers, it's family members, it's friends, it's GPs, it's occupational therapists, employers, and most of that is done through our online ME centre. We are quite a small team, but we do reach a lot of people through that. Some of you may well have seen it. There's publications you can download for free. There's a whole range of fact sheets. We have a services directory, so you can go in and search on a map and see what's in your local area. We have forums that people describe as a lifeline because they can connect when they're completely socially isolated and they can talk to each other about what works. We also provide a specialist welfare advice telephone line, email support service, and we take calls into the office. We also run a series of events, and we've tried really hard over the last couple of years to get out and meet people and to come away from London, so that we're actually running events like today. We had one in Sheffield earlier this year, we've had one up in Scotland, and we've got a number planned for the next few months. The other thing that we do is what we call our research touchstone, and that includes a whole range of things, and I'm going to say a little bit more about that in a moment. But there are 2 things that are fundamental to all of this. One is we have to bring in the money to do this because we don't get government funding. But the other is that everything that we do should be done collaboratively where we can do that. We cannot do this alone, and it's really important to work with the charities like we are today to be able to achieve what we're achieving, to work collaboratively with the medics, to work collaboratively with social care professionals, with researchers and with others, and most importantly, people affected by ME. And I hope that that people are starting to see a shift in what we're doing over the last year or two, so that we do that better. You won't be able to see this at the back, but you can see this on our website. And this is about a year, 18 months ago, we undertook a whole review about what we do, how we do it. And part of that is looking at our research work. And we undertook a survey with over 1,000 respondents to look at what priorities we should have as an organisation, and then fed those priorities in to the UK Research Collaborative. And from that, we set out what our vision, our goal and priorities were, and what our themes were. The majority of our work that we do from a research perspective is biomedical focused, but not totally, because it can't be. And we heard earlier on about separating the mind and body. So we are involved in things like a disease register, and we have in the past been involved in epidemiological studies. So it's really important for us not to be completely biomedically focused, and it really does depend on how you define that. But the majority of the work that we fund does have that biomedical focus. So just to tell you a little bit about the studies that we fund. As you heard, we funded the work in Northumbria University, and to hear Zoe today, I think Zoe was very nervous, and I think she did a very good job of explaining her work, but I think she undersold what she's actually been doing. It's very early stage. As Zoe said, we know very little in the sleep field about the impact of sleep or lack of sleep for people with ME/CFS. And Professor Jason Ellis, who Zoe's worked very closely with, stood at our conference last year, our research conference in November last year, and said, if you're sleeping all day and you're still sleeping all night, then your body needs that sleep. If you're sleeping all day and not able to sleep at night, then there's something more that we need to find out, so we can actually understand what is going on in your body and work with you to address that. And you can only do that if we can understand the different subsets or the phenotypes, because we've got to be able to personalise the treatments that people have. It's no good offering, one or two different treatments and suggesting that's going to work for everything. We know that that's not the case. There is no evidence base that suggests that that is the case. We have to understand more about the different subsets. So to hear that our small amount of funding went in to identify 4 sleep phenotypes, it's a starting point. It's not going to give all the answers, and it may not be able to speak directly to your individual circumstances or your children's circumstances, but it is a starting point in a field where there was very little about sleep at that point. So we're really rooting for Zoe to hope that she goes on and gets funding for her fellowship, because there is absolutely more that needs to be done. We have so that piece of work has now concluded, and another piece of work that's recently concluded is some work that we funded with Sheffield University that was using the fMRI scanners to look at what's going on in the brain whilst people were undertaking specific tasks, cognitive dysfunction. And that work has concluded. I'm told there are some very exciting findings. I'm not allowed to share that with you. We're not allowed to put up a report on our website as yet, because that would prejudice any publication. We are hoping that there will be a publication with those results that comes out soon, and then we'll be able to share that with our members and supporters that helped fund that study. We're also partway through a 3-year research project with Professor Julian Newton up in Newcastle, and they're employing some really interesting techniques where they're growing muscle cells in the laboratory, and then they're testing them to look at what's going on with the autonomic nervous system. And there is and I'm not going to try and say too much because I'm not a researcher, so if you want to hear Julia talking about it, go to the Action for ME website, where you can actually watch a video of her talking about the piece of research and the findings they've got. But it's absolutely fascinating, and there is a drug that could actually help. The fact that it's completely toxic for human consumption at this point is a bit of a nightmare. So what they're doing is looking at what else exists and what they can do with that drug to see if there's any way that there might be in the future an opportunity for that to be prescribed. So this is really cutting edge stuff that is going on at the moment. And Keith said earlier on that actually, we're starting to see some developments within the research field. It's nowhere near enough, but at least it's a good starting point. We're also funding the UK Biobank. So that is, there's a team at the London School of Hygiene and Tropical Medicine that have been collecting samples from people, a whole range of different samples, and collecting them and keeping them at the right temperatures and all of the other things they need to do, so that the samples can be available as an infrastructure for researchers and for future research. They've collected over 200 samples. We're just about to conclude the second phase of funding for that. And they've gone on to secure a grant from the NIH in America, the National Institute of Health, to the tune of $1.5 million. For our bit of funding, the bit of funding that also came from ME Research UK and ME Association and a private donor, we all put that together. That's gone on to leverage $1.5 million from the US, which is unheard of. So that's really exciting, and we're going to continue working them, although our funding is stopped, because we only fund sort of pilot projects, feasibility projects, to get things going with the view that they then go on and attract mainstream funding. We should not, you should not be funding the research on an ongoing basis. We can help get it going, but people like the Medical Research Council, the National Institute for Health Research, they should be funding this as mainstream illnesses, in the way that they do other illnesses. So we're working really, really closely with them and with our research projects to help them go on and secure that funding. And that includes writing a letter of support if needed for people like Zoe that are going on to apply to the NIHR. We're also funding the disease register, and that's where there's a whole range of information collated about people's symptoms, their illness, etc. in one place that again it can be interrogated from a research perspective. Now that project we've had a number of difficulties with that due to IT, technology issues, and also sickness of key personnel. But that project is going, it's just happening an awful lot slower than we all hoped. So there isn't much more that I can say about that at this stage. We've got two new projects that we have. One project we've just launched in the last couple of weeks, and that's with Northumbria University, focused on immune responses, and another on mitochondria DNA, which we're just about to sign the contract for with Newcastle University. And these two individuals are people that are from outside the MECFS field that have been so inspired by the work that's been going on through Professor Julian Newton, through Jason Ellis, the work that Zoe's doing, that actually they're starting to come into the field. That's fantastic, because there isn't enough funding, but there are also not enough researchers in this field. And we need people with the expertise in sleep, in mitochondria DNA, in immunology to actually come into the field and bring what they've learned and the insight that they've got so that we can learn more within this field. We have, some of you may have heard that the sad news that the CFS Research Foundation has now closed following the sad death of the founder, Anne Faulkner, last Christmas. And so we were asked by the foundation to take on a project that they'd already agreed to fund called The Brain in Pain, and Gabriella mentioned it earlier on, which is a project that's being undertaken. Peter White is the lead primary investigator for that. And I'm due to meet in a couple of weeks with Peter and with the team to find out a little bit more about that study. There is some patient information that's available on our website, so you can read a little bit more about that. But one of the things that we are doing with all of our funded research projects is to think about how do we communicate with our supporting members, with the general public, about what's happening with these research projects. So Newcastle, they're doing a lot of work through Facebook, through Twitter. They're out there communicating, saying this is happening, we've got a problem here, we've just recruited, we've met our target of 100 patients, whatever it may be. But we're going to start releasing some short clips of films with researchers talking about what they're doing, giving updates, because it's really important we know what's happening. And if things aren't going well or things are changing, whatever the issues may be, that needs to be communicated to us within the wider public. That helps to demystify it a little bit more, but actually it also helps to recruit patients. And I met this week with an MRC-funded researcher who is struggling with recruiting patients for their study. There is some information out on one of the tables about that. A lot of research studies have very specific criteria that rules individuals out when they be located in a specific area of the country. So we're going to look at potentially running, I don't know how else to describe this, as a bit of an ads sort of page on our website where researchers can say, this is what I'm doing, this is who I'm looking for, if you're interested, this is how you can contact us. I get lots of emails from people saying, I really want to be involved in research. I've had this awful illness for years and years and years. I want somebody to find some answers. So we're going to look at how we can try and connect patients with the researchers. The other thing that we do is to partner with research projects. We've got a number of projects that we will go in and sit on trial management groups, steering groups, whatever labels they're given. But we also link people. We have a patient reference group that we launched earlier this year. We have just over 50 patients and carers as part of that group, and already they've commented on protocols, questions for qualitative interviews. They've helped inform our strategy. They've been involved in a whole range of different things. And that's been really helpful for us because it means that, you know, people are feeding into what we're doing and giving comment. And believe me, that group is very critical, and that's fantastic. You know, it's great for people to say, oh, well done, you're doing really well. But we also need to hear when things aren't quite right. And you're not going to please everybody all of the time, but we still need to know where we can do better. That will help us do what we do an awful lot better. And the feedback that we've had from researchers has been absolutely fantastic to have access to a group of people that are that critical and help strengthen what they're doing. As I mentioned, we're working very collaboratively to make sure that everything we do, we get the most value out of. Whether that's putting our money together and funding things together, or whether it's actually going out and saying, how can we work with mainstream funders, with researchers to actually get that little bit more funding that's needed to stimulate interest from early stage, sort of early career researchers in the way that Zoe's been. And it's been fascinating to see actually the number of PhD students that are coming forward that say, oh my goodness, I never thought I'd work in this field, and now I've been involved in it, this is where I want to be. Because if we haven't got people coming through, and with the best will in the world, you know, people retire, they move on, they move out of the field. We need people continually coming into the field. The other thing that we are starting to do is where we talk to people, researchers that have an interest in something that might be related to the ME/CFS field, we try and bring them together. So last week when I was up in Newcastle, there was a researcher that I met from Edinburgh who gave a presentation, really interesting presentation on work that he's done in the MS field. And I said, well, why haven't you done anything in ME/CFS? And he said, that's a very good question. Professor Hugh Perry has been saying that to me as well. I said, great, what are you doing on such and such a day? Can you come to a meeting? And we pulled together people like Julian Newton and others, just so that he could present his research and say, how can I get involved? Is there anything you're doing that I can get involved in? And I think we might see a project that might come from that one meeting. That's hugely exciting. So the more that we can do, not just us as a charity, but the other charities and the research collaborative in bringing people together and exciting people to get involved, you know, that doesn't really cost much money to be able to do that. We haven't got the hundreds and thousands of pounds that we can invest in a large trial like Zoe was talking about, but we can bring people together and we can invest in the smaller scale sort of research projects. So just a little bit on our time to deliver report. And this was very much to follow on from a piece of research that we did 6 years ago, and to look at how ME affected and impacted on people. Now, I could have sat there and written a list and said, this is what I think we might find in the outcome of this study. But it's really important to do if we're going to provide an up-to-date evidence base to inform and influence what we do. And actually it's really important to see what differences there are that come forward, and to see what good practice there is, what the impact of recent welfare reform changes have had, and how we can actually work together with others to improve outcomes. So this was a self-selecting survey. It wasn't highly scientific. We didn't need ethics approval. So there are criticisms that you put in place before we even start. However, there was some really interesting data that came out of that. And as you can see, over 2,000 people responded. The majority of people responded by filling in the forms rather than doing it online. And then myself and Claire and the team sat there night after night after night inputting that data. And I tell you, I haven't cried that much in ages. It was heartbreaking to hear from people, to read people's writing, to hear their experiences. And for some people, that was the first time that they'd had an opportunity to put that information down in that way. I cannot tell you how much it moved us individually and as a team. And many of you will know, from your own experience, how awful that can be. What we did find was that actually looking at the percentages in terms of who completed this, it is representative of the overall demographics. So, we did have quite a representative response. Here's just a breakdown in terms of, and you can read this report on our website, so you can actually see some of this data in more detail. And we looked at the sort of NICE guidelines in terms of mild, moderate and severe ME, and we broke that down in terms of when people were self-defining how the illness affected them, so you can read a little bit more about that again in the report. So we outlined some of the impact that the report had, and the statistics weren't hugely different from 6 years ago, but it wasn't surprising to see that 87% of people had stopped or reduced paid work. Now, if we could turn that into a monetary value for the amount and the impact on the economy, as we have done many, many years ago, that's a figure and statistic that politicians will sit up and listen to. And we have to be better at how we use this information. I haven't got all the answers now, it's a huge piece of work, we're just at the beginning of that journey, but we are starting to think about what else can we do to turn these statistics into money to make people listen. There are other things like the number of people that affected the decision about whether or not to have a child, the impact on ability to drive, and people not being able to leave home independently. But actually 92% of people have stopped or reduced social contact. I've sat in a Saturday evening with friends over dinner and said, given that statistic to people, and it's really hit home for people that actually, people who know very little about ME, what would it be like if that's, if suddenly after an illness that affects you, not just for a week or 2 weeks, or a year or 2 years, but year after year after year. There's lots of data that we've got, and we will be producing more reports, but there are statistics like 32% have not seen a GP in the past year. So when you hear Zoe talking about actually, the phenotypes and the variability of sleep changing, if people aren't being asked about how their symptoms are changing, how can their treatment, if any, or drugs that may be used for sleep treatments, how can that be changed and adapted to meet those specific circumstances and symptoms at that point in time? So there are lots of things that could change if people were being asked the right questions, were being seen by GPs. And so we're using this data in the work that we're doing with GPs and thinking about how can we move towards a more personalised and targeted approach. ME, as you know, affects different people in different ways at different times. It's not okay to say we've got 1 or 2 treatments, that's it. That is absolutely not okay. There's lots of data in there about what people wanted to see. And we're not trying to bash GPs. So I said earlier, there's some amazing GPs out there. But actually 69% of people said they wanted their GP to be better informed about this illness. GPs are general physicians, they can't know everything about anything, or can't know everything about everything, sorry, get that right. But actually, we've got Google, I'm not saying you, but you've got your map of medicine, you've got lots of other resources, you've got actually for ME website, you've got lots of resources that produce trusted information. We've got to be better at getting that out there. So there are a number of things that we have started to develop on the back of the findings from this report. We will make a copy of presentations available, so they will be available for you afterwards. It's quite interesting data around the management approaches that people use. Now, just remember the kind of health warning that I gave earlier about self-selecting data and the way in which people are reporting. There's nothing scientific about this, but it does provide some really useful insight. to see what's changed. You know, actually more people are citing pacing as being a management approach that supports them, you know, better than anything else. And I think the quote at the side there from somebody about the specialist service really highlighted for us through this piece of research the misunderstandings and perceptions that people can and do have about the clinics and what is and isn't going on within clinics. I'm going to skip through some of this because I've got to keep an eye on time and make sure I don't steal the time from Mary-Jane. But there was quite a section in there about welfare, employment and education. And the data, again, wasn't surprising. But what we have gone on to do, and one thing I'd like to announce today, is that on the back of the findings from this and some other consultations that we have undertaken, we have just in the last week or so secured funding to be able to deliver a specialist employment support service. Now, for some people, employment is a dream in the distance that may or may not be realised. But there are some people that are being seen in clinics that are needing to stop work because of their health. And they need support to be able to do that well. So if at the point in the future they're able to get back into the workplace, they've left work in the best possible way with references, etc., that will help them to get that first step back in. There are some people that are well enough to be able to retain a small amount of work. There are some people that have, after many years, just got better and been able to move back into work. That is not everybody. I'm not downplaying the illness, but there are many people that we talk to and support that are in employment in some way. Some of them may be working from home. You know, some of them might be working in an office, you know, whatever that might be. But a year ago, a specialist clinic and a patient came to talk to me in Bristol and said, look, we're seeing these individuals that need support and nobody is giving them support. And so can you do something about that? So we've worked with a group of organisations, including Remploy, with the Bristol Specialist Clinic, Adult Clinic, with patients, and we have now set up a specialist service. We've secured, we've got just under £100,000 to be able to deliver this, to see if we can put specialist support in and whether that will have any impact. It may not, but we've got to give it a go because there are a number of people that have said we would really like help here. So there'll be more information about that coming out over the next few days, but you're the first to hear that today, and we are really excited about that. We know that we will get some criticism because there are people, you know, we know that there's approximately 25% of people, as we saw in our survey responses, people who are nowhere near, you know, well enough to be able to work, but we are focusing on a group that are and supporting those individuals that need to leave work well. We also looked at the impact for carers, and a shocking statistic here for us was that there were a number of family members that hadn't had a carers assessment. There is a lot of work that we need to do to make sure that people get that information. And also looking at the impact for children and young people with a family member who has MECFS, and working with young carers organisations and putting together a specific resource with them. I'm not going to say much about severe ME, and if you talk to people like Professor Stephen Holgate, he'll say, well, there's no such thing as severe ME, because actually with all illnesses, there's a severe end, a moderate end, and a mild sort of end of the spectrum. Whether they've got mild ME, actually some people might be affected mildly, but at certain times they'll be affected more severely and might be housebound. So it's an interesting kind of concept, but for the purposes of our survey that we did, we've looked at that data and we'll be producing a more detailed report at our symposium in AGM. You can sign up for that. There are still places available which will take place in London next month. So I'm going to leave it there now. This is where you can find more information. I really welcome people contacting me directly. I respond to every single email that I get. I don't have a wonderful team sitting there doing that for me. So if you've got questions, please do let me know. I have a poorly boy at home and I've had some very upsetting calls today, and I'm really desperate to get home as soon as possible after today, so I'm afraid I'm not going to be hanging around to be able to talk to you, but please do drop me an email, phone the office and speak to me if you've got questions. I'm very happy to talk to you. Thank you.
so I don't plan to run over on time, so I'm going to probably skip through quite a few slides. I'm sure most of you here will know of AIM or know AIM, and that we are a very small charity, and we don't have any funds to fund research. But that doesn't mean we aren't involved in research and we don't support research. And more importantly, so do our members, who are some of them very active in supporting research. I wanted to remind you of the work that we do though, just very quickly. There's nothing here that anybody in this room isn't aware of. The national picture, we're still faced with a lot of challenges. You know, we heard from a mum today who is clearly quite distressed about the lack of help that's available for symptoms. And I think we all know that much work still needs to be done. And that's why I, for one, am very happy to be collaborating so closely now with Action for ME, because there's so much time can be wasted if we try and replicate work. And we don't have, either of us, the resource to waste. And being invited by Sussex and Kent to come here today is another example of good use of time and resource. We do work really closely with the NHS specialist services. I firmly believe for the last 12 years, that knocking and shouting from outside the door makes not a blind bit of difference. It just means someone puts a bolt across the door. If you're inside and involved and you know people, then if one of my members has a problem with the service, the door's going to be open. I can call, I can ring, I can visit, and we can go in and we can talk about it, and we can try and find a resolution. And I have to say, we normally do. It also means that if one of our members has got a real problem, I know where to go for help, and it's really made a difference. I was working for AIM before we got the funding for the specialist CFSME services, and for many of you will know those days as well, and it was a bleak time. It's still not good, it's a postcode lottery, but it's better than nothing. What we have to do is again work collaboratively to continue to improve it. We empower our children, young people, parents and carers. There aren't enough of us. There are 2 full-time members of staff at AIM and 4 part-time people. We can't go racing around the country solving everybody's problems. But I was talking to a parent earlier who didn't even know we had a helpline. The helpline's open from 10 till 2 every day, and what we can do is we can inform you, we can signpost you, and we can empower you to change your lives for the better. So please do use that resource. There's over 40 years knowledge and experience behind that helpline, and if we don't know the answer, what we'll do is we'll find somebody who does. We really continue to work very hard on the limited resource we've got, financial resource that is, to continue to raise awareness and understanding of the condition. But our biggest resource, and the resource I'm most proud of in raising that awareness, is our young people. AIM's youngest member is 3 years old, and our members from the age of 3 up to the age of 26 get involved in raising awareness. I'm thrilled to see faces I know here today, young people that are new to AIM, young people that work at a very senior level as volunteers for AIM. And the work that they do, raising awareness, looking after one another, empowering one another, caring for one another, is just mind-blowing. And they have a need, every single one of them. So it doesn't matter how big or small the job they do is, they know that they're contributing to making a difference. And I'm incredibly proud of every single one of them. And here's Patrick. Patrick has ME. He has days when he can't get to school. He looks really well here, doesn't he? You all know that. But he actually came to be part of education and spoke at a symposium where they were trying to get information about education, and we were rewriting the guidance, and they wanted young people with long-term conditions input. And Patrick was very vocal about where the current guidance was failing young people with ME quite badly. And in fact, his parents and I didn't get a word in edgeways. It's very typical of our young people. When they get the opportunity to speak, they have plenty to say. And that guidance has now been rewritten and relaunched. And AIM was so proud to be one of just 4 national charities to be asked to rewrite that guidance by the government. So I'm not talking about me, I'm talking about young people with ME here. So the helpline I mentioned takes over 1,000 calls every year. Our most recent exciting resource is the Children in Need of Funding a National Support Worker. We actually have two, one who's based in the North East, one who's based down at the office in Milton Keynes. And these have taken off my shoulders all of our crisis cases, and they work with 189 individual families this year who have found themselves in real crisis. Many of our families are in crisis, but I'm talking about those in most desperate need, who need more than we can deliver from the helpline. And that's really making a difference. In addition to that, myself and these two national support workers, I've been doing it for 10 years now with an AIM member. We have a 24/7 alert crisis button in the members area of the website, where if somebody's feeling really desperate and suicidal, they can contact me 24 hours a day, 7 days a week. And over the years, we've actually prevented 5 suicides. So that's the kind of work our members are doing. And that young woman that's done that work with me for 10 years has now gone on to become a qualified social worker. She qualified last week. So she's going to be doing a lot more work to raise awareness. I'm going to mention her name's Siobhan Bedford. And she went along with Jill Moss, our founder chair, to Buckingham Palace last year to collect the Queen's Diamond Jubilee Award for volunteering, which was presented to just 60 national charities. So we were up there with the big boys, so our members were very proud, as was Jill on that day. Her courtesy to the Queen was quite impressive. So for a tiny charity, we do a lot, and I'm proud of how much we do. We do attend the APPG, we attend Forward MA, we're on the Executive Committee of the UK CFSME Research Collaborative, and also the British Association of CFSME, BACME. We might not have the loudest voice, I might not be able to do as much as I'd like to do. I'd love to be able to do more, but we're there and we're present. The one thing that hasn't been mentioned anywhere else today is BACME. That is an association for professionals working with adults and children with ME, and they come together every 18 months in Milton Keynes for a conference. And what's really important there is you've got professionals sharing information, sharing knowledge, sharing what they've learned, passing on the knowledge and information that they've gleaned from their patients. So we're very proud to be part of that organisation. I couldn't show you all of our young people today, and I'm not going to read what Katie says because, again, these slides are all going to be available on the website. But Katie runs just one of our services. She runs our special services for our most severely affected members and our jammers. Our jammers are our junior members who are up to 12 years old, and then our salmons are our severely affected members. And Katie does this as a team leader. I won't embarrass him, we've got an ex-team leader sitting here in the room today. And these young people do an amazing job. They manage teams of 30, 40 young people without ever meeting them. They do it all by email, and I don't ever get a moan or a complaint. They are really, truly an amazing inspiration. Katie was nominated by AIM, along with 2 other of our team leaders, for the Daily Telegraph Lend a Hand Volunteering Award, and she went to London last week. She was only one of only 3 finalists. She didn't win, but that doesn't mean we aren't incredibly proud of her. And she said she was there to represent everybody who'd ever volunteered for AIM. I can show you stats. They're sad. I don't see these stats as something to be proud of. It means that there's still a hell of a lot of families out there that are desperate for our help. We rely on you, both Sonya and I, to spread the word, to help people know where to find us. And our website stats grow year on year. For a small charity, they've doubled in size in the last 2 years. So it means there are still a lot of desperate people out there. The reason I put this slide up is this is an area that I personally focus on quite a lot. I see my job in all of these organisations that I attend as making sure that children and young people remain on the agenda, and I know Sonya feels just as passionate about it as I do, the severely affected don't ever slip off the agenda. I know it feels to the severely affected as though they're completely unseen and unheard, but I can assure you, Sonya and I are banging the drum, banging on about you all the time to make sure that as soon as possible, as soon as it's absolutely feasible, the severely affected will be included in research, and certainly they're on the table. So I think Sonia's jumping back up now to talk to you about the UK CFSME Research Collaborative and the work we're doing with them. And that's just a slide to show you a few of the people that are supporting AIM at the moment. So Sonia, I'm going to sit down, Sonia's going to jump up, and then I'm going to jump back up again. So thank you for giving me a few minutes just to remind you of the work that we're doing at AIM.